Fentanyl citrate lozenge on a handle is a medication used to help relieve sudden, breakthrough, cancer pain in people who are regularly taking moderate to large amounts of opioid pain medication. It belongs to a class of drugs known as opioid analgesics and works in the brain to change how your body feels and responds to pain. It should not be used to relieve mild or short-term pain such as due to headache/migraine, dental procedures, or surgery. The recommended dosage and timing for taking this medication should be determined by a healthcare professional. Before using fentanyl lozenges, make sure to carefully read the medication guide provided by your pharmacist. If you have any questions, don't hesitate to ask your doctor or pharmacist. To use fentanyl lozenges, place the medication end in your mouth between your cheeks and gums and actively suck on the medication. Twirl the handle often and move the medication along the cheeks in your mouth, occasionally switching sides of the mouth. Finish the medication in 15 minutes for the best relief. Do not bite or chew the medication, and avoid eating grapefruit or drinking grapefruit juice while using this medication unless your doctor or pharmacist says it's safe. If you start to have side effects before finishing a dose, your doctor may need to adjust your dose. The dosage is based on your medical condition and response to treatment. You should also continue to take your long-acting opioid medication as directed by your doctor, and ask your doctor or pharmacist about using fentanyl safely with other drugs. Suddenly stopping this medication may cause withdrawal, especially if you have used it for a long time or in high doses. To prevent withdrawal, your doctor may lower your dose slowly. If this medication stops working well or you have concerns about addiction, talk with your doctor. Finally, tell your doctor if your pain does not get better or if it gets worse, or if you have more than 4 episodes of breakthrough pain daily, or if you need to use 2 units of medication for each episode of pain. Some common side effects of using the fentanyl citrate lozenge on a handle include nausea, vomiting, constipation, lightheadedness, dizziness, drowsiness, headache, and pain, sores, or irritation in the mouth. These side effects may decrease over time, but if they persist or worsen, it's important to consult your doctor or pharmacist. To prevent constipation, it's recommended to consume dietary fiber, drink enough water, and exercise. In some cases, a laxative may be necessary, so it's best to ask your pharmacist for the right type for you. Additionally, to reduce the risk of dizziness and lightheadedness, it's important to get up slowly when rising from a sitting or lying position. It's important to remember that this medication has been prescribed to you because its benefits outweigh the potential risk of side effects. However, it's essential to seek medical attention if you experience serious side effects such as interrupted breathing during sleep, mental or mood changes, severe stomach or abdominal pain, difficulty urinating, or signs of your adrenal glands not functioning well. In rare cases, this medication may increase serotonin and cause a condition called serotonin syndrome/toxicity, which requires immediate medical attention if symptoms such as fast heartbeat, hallucinations, loss of coordination, severe dizziness, severe nausea/vomiting/diarrhea, twitching muscles, unexplained fever, or unusual agitation/restlessness occur. If you notice any symptoms of a serious allergic reaction, such as rash, itching/swelling, severe dizziness, or trouble breathing, it's crucial to seek medical help immediately. This is not a complete list of possible side effects, so if you experience any other effects, it's important to contact your doctor or pharmacist. Fentanyl lozenges are used for managing pain in patients who have been regularly taking moderate to large amounts of opioid pain medication. It's important to use the smallest effective dose for the shortest possible time to lower the risk of potential abuse, addiction, and overdose. It's crucial to be aware of the signs of an opioid overdose and have naloxone available to treat it. The risk of severe breathing problems is higher when starting this medication or after a dose increase, so it's important to use it exactly as prescribed. This medication should be stored safely to prevent misuse or abuse, and any opened units should be properly disposed of. If you are pregnant or planning to become pregnant, it's important to discuss the risks and benefits with your doctor before using fentanyl lozenges. Additionally, using this medication near the expected delivery date may harm the unborn baby, and babies born to mothers who use this drug for a long time may develop severe withdrawal symptoms. Before using fentanyl citrate lozenge on a handle, make sure to inform your doctor or pharmacist about any allergies you may have, as well as your medical history, especially if you have any brain disorders, breathing problems, diabetes, kidney or liver disease, mental/mood disorders, or a history of substance use disorder. This medication can make you dizzy or drowsy, so avoid alcohol or marijuana while using it and be cautious when driving or using machinery. It's also important to inform your doctor about all the products you use before having surgery. Additionally, be aware that this medication contains sugar, which can increase the risk of developing cavities or gum problems, especially for those with diabetes. Older adults may be more sensitive to the side effects of this drug, and pregnant women should only use it when clearly needed and after discussing the risks and benefits with their doctor. If you are breastfeeding, consult your doctor before using this medication. This medication may interact with other medications, affecting how it works or increasing the risk of serious side effects. It's important to keep a list of all the products you use and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Some medications that may interact with this drug include certain pain medications, mixed opioid agonist-antagonists such as butorphanol, nalbuphine, pentazocine, naltrexone, and samidorphan. Other medications can affect the removal of fentanyl from your body, which may affect how fentanyl works. Examples include azole antifungals, calcium channel blockers, HIV protease inhibitors, macrolide antibiotics, mifepristone, nifazodone, rifamycins, ritonavir, and certain drugs used to treat seizures, among others. Taking MAO inhibitors with this medication may cause a serious, possibly fatal, drug interaction. Avoid taking MAO inhibitors during treatment with this medication. The risk of serious side effects may be increased if this medication is used with other products that may also cause drowsiness or breathing problems. Tell your doctor or pharmacist if you are taking other products such as other opioid pain or cough relievers, alcohol, marijuana, drugs for sleep or anxiety, muscle relaxants, or antihistamines. Check the labels on all your medicines because they may contain ingredients that cause drowsiness. This medication may also interfere with certain lab tests, so make sure lab personnel and all your doctors know you use this drug. If someone has overdosed on fentanyl citrate lozenge on a handle and has serious symptoms such as passing out or trouble breathing, give them naloxone if available, then call 911. If the person is awake and has no symptoms, call a poison control center right away. U.S. residents can call their local poison control center at 1-800-222-1222. Canada residents can call a provincial poison control center. Symptoms of overdose may include slow breathing, slow heartbeat, coma. Please note that this medication is prescribed specifically for your current condition and should not be shared with others. It should also not be used for any other condition without the guidance of your doctor, as a different medication may be necessary in that case. Fentanyl citrate lozenge on a handle is used for the management of breakthrough pain in cancer patients who are already receiving and who are tolerant to around-the-clock opioid therapy for their underlying persistent cancer pain. The recommended starting dose of fentanyl citrate lozenge on a handle is 1 lozenge of 200 micrograms. Patients should be titrated to a dose that provides adequate analgesia with acceptable side effects. The lozenge should be consumed over 15 minutes. Patients should not use more than 4 units of fentanyl citrate lozenge on a handle per breakthrough pain episode and more than 4 units in a day. When storing fentanyl citrate lozenge on a handle, make sure to keep it at room temperature, away from light and moisture. It's important not to refrigerate or freeze it, and avoid storing it in the bathroom. Always keep all medications out of reach of children and pets. When it comes to disposing of this product, do not flush it down the toilet or pour it into a drain unless specifically instructed to do so. Properly discard the lozenge when it is expired or no longer needed. For more details on how to dispose of it, you can refer to the medication guide, or consult your pharmacist or local waste disposal company. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.